Hey, how's it going? My name's James. I'm the founding clinician here at Meelio, and I wanted to quickly share how things used to run in our practice before Meelio and now how they run with Meelio. If you were like us before, and especially when we first started out, it felt like everything was spaced out. We had our EHR, we had our meal planning software, we had Chronometer for tracking calories and meals, and we had another portal for our program, and then we had another software to deal with our pricing and memberships, and then we have our website, and we have all these things spaced out everywhere. With Meelio, we created this and designed it to be an adhesive glue to your ecosystem. So before, our workflow was logging into the EMR and helping our patients find the link and get on the link. And after the visit, we're typing everything during the conversation, which we're trying to connect with our patient and really get to know them and really help them with their health story and their care plan. We're typing away, we're making sure we don't miss anything. There were many pauses of, hold on, let me just write that out quickly. I typed pretty fast as well, but it was still a struggle. Then after that, we had to go to a separate program, and typically this would be our admin staff. Early on, it was the dietitians in our team using their very expensive time to write these meal plans. Before even having a meal plan software, it would take us hours. Even with a third-party meal plan software, it would take us anywhere from 45 minutes to an hour. Then we'd have to download that and put it back into the EMR, link it to their note, complete the note, and then we have a third-party biller, and then we had to go through a third-party lab and download it ourselves and have our admin assistants download it, and the list goes on and on. And we could be here all day talking about this. After and with Meelio, now we are using Meelio to listen and transcribe our visits. Meelio is generating our care plan. Meelio is creating meals, is creating a beautiful meal plan based on our patient's information that it has an intricate and inherent knowledge of. Meelio is learning our practice, is learning how our dietitians do things. It's learning about our patients. You're able to intuitively respond to Meelio as it intuitively learns and listens to what's going on. So it is creating, almost as if an extension of yourself, the meal plans and the care plan, which can easily be pushed into the EHR. For us, our EHR is Serbo, and it syncs really nicely with more and more integrations coming down the pipeline to make things even easier and more seamless as we go. So Meelio has replaced our separate scribe. It has replaced our separate meal planning software. It has replaced a lot of our dietitian's time, which is extremely valuable, as well as replaced a lot of our admin hours, which is also extremely valuable. If you're running your own private practice, if you're just starting out as a solo practitioner, or if you're running a practice with multiple providers, you know saving money is everything. As costs are increasing, we must use technology to help us offset some of those costs so we remain in the black, we don't go in the red, and we don't have to inflate and bloat our admin costs just to stay afloat. This isn't just another admin tool. This isn't something extra you have to do, your patients have to log into. This is something that seamlessly connects with what you're doing, and it will likely take away from you having to pay monthly costs to separate programs and separate softwares. Meelio is this nice, cohesive, integrative, and functional glue that is bringing everything together and seamlessly connecting so many things and even replacing and concentrating everything you need all at your fingertips so you can become more efficient, so you can better care for your patients. And on top of that, you can better care for your time so you're not spending extra hours in the office or in your home office that you don't need to spend, so you can be with your family, you can go live your life, and you can actually be practicing what you preach by living a balanced and healthy life so you can make sure you're exercising, eating healthy, and having balance in your life so you're not burning out as a practitioner. I hope you're enjoying using Meelio in your real clinic workflow. Give us your feedback. Let us know what you like, what you don't like, what you feel you can change. But within Meelio, you can adjust those settings. You can make things and tweak things and modify things to fit your needs. So no matter what practice you have, in terms of how you're seeing your patients, Meelio can work for you. If you haven't tried Meelio yet, click below and start your free trial today.